Good morning, everybody. Will Dupree here in the KXAN live studio. We are about to bring you a live update from Hays County. Two different people from the epidemiology team that work for the county are going to talk about the COVID-19 outbreak, give us a status update on schools and hospitals, and also share some safety advice about the upcoming Thanksgiving and Christmas holidays. Let's take a listen as this news conference that's happening virtually begins.
Hospitals, schools, etc. We're going to talk about why cases were removed and the rationale for that. And then we're going to talk a little bit about the upcoming holidays, sort of like what to know, precautions, things like if you're having guests or you think you're going to travel and issues along those lines. And then we will open the floor up to questions. Because we are on the free version of Zoom, we only have a limited amount of time. So I'm going to only take one question per media outlet. And if we've already covered your question, great. So I'm going to mute myself, which is always a good thing, and then turn it over to Eric, and we'll get going. Hold on, I got one more person in the waiting room. Okay, and I know everybody knows the rules. Just keep yourself muted unless you are asking a question, and then mute yourself again because background noise and everything else. So I'm going to mute, and Eric, take it away.
Good morning, everyone. Just like the rest of Texas, we are seeing an uptick in our caseload. About 2 weeks ago, we were seeing somewhere around 30 new cases per day. Now we are seeing almost about 50 new cases per day. So we are starting to see a surge, which is something we expected after the Halloween. We were seeing this coming. A concern for us is the upcoming Thanksgiving. We are worried about large family gatherings getting together from people who are traveling from all over different areas. Here in Hays County, we know what's going on here. We have a good idea watching the media and reading news stories about what is happening in other cities and counties as well. And so we're very concerned about large family gatherings getting together. So it's kind of why we're getting together and talking here today. Yesterday we reported, I believe it was 73 new cases. That's a pretty large spike, but the big concern was that we reported 7 new hospitalizations yesterday. That is definitely the largest number of one-day hospitalizations that we've reported since this began. And so kind of wanted to just be able to talk and answer any questions that y'all do have about trends that we are seeing here in Hays County. I guess I'll start with ISDs. We are seeing cases on campuses, pretty much on almost every campus in all the ISDs here in Hays County. We're relying on the eyes and ears of the nurses and the staff there because they know exactly what is going on campus. And so they're able to determine and do the contact tracing of who was there, who was being at high risk for a potential exposure. And then we consult with them, work with them, and all evidence is showing that they're not having any spreading that is occurring on campus. It all seems to be occurring from outside activities away from school. Same thing with the Texas State University. Their numbers are ticking up just a little bit. But again, they are doing their own contact tracing. We're consulting with them. And same thing, there's no evidence of classroom spreading or on-campus spreading. It all seems to be occurring from off-campus events. It's kind of the trends that we are seeing right now. That's, we're seeing the uptick. And that's kind of really everything that I have at the moment as far as talking about what our current trends are. I'm going to hand it over to Hayden Matz because I know that a lot of you have questions about the new numbers reporting that we sent out the press release last week. So I will let Hayden Matz address that.
Hi, everyone. So I'm sure a couple weeks ago, y'all noticed that we took about 200 cases off of our total case count for Hays County. The reason we were doing that is because we were holding on to some cases on our report that weren't actually ours or were transferred off or were duplicates. So for one reason or another, they weren't actually true cases that needed to be reported out. So because of that, we needed to do a big correction on our end of day report. So we did that. It took about 200 cases off. However, the main reasons why those cases were added in the first place, like they're still occurring, It can be from a person getting a COVID test at 2 different clinics, and the clinics put down their name differently. So whenever we go and we data enter that person onto our line list, our internal auditing that we have doesn't automatically flag that case as a duplicate, so it gets added. So in order to catch that, we have to go and do more in-depth auditing to go and manually identify that case as a duplicate and flag it to be removed. So if we did not remove that case from our end of day report, then the numbers that we're putting out to the public would not be as accurate as internally our own records show. So in order to have this being an ongoing discussion with us in the community, every Friday, we're going to run an internal audit to identify the amount of duplicates that we identified in the week prior, and then deduct those from the total case count that we put out at Friday evening. That way, after that report, what our internal list is will match up perfectly with what the list we put out to the public is. That way, we're able to guarantee validity between both lists and give the correct numbers to the public. And I'll throw it back to Eric if he has anything else to say.
I think you covered that quite well. It answered, a lot of the questions about the types of cases that we, have to take out so that it's all accurate.
Yeah, because also some of the cases that we might have to take out is also transfers. So somebody may have gotten tested in Hays County. However, the clinics, they don't really check to see what county that person's actually a resident of. So they'll send a case to us. We'll add them. Sometimes it'll have a local address, sometimes not. If it doesn't have a local address, then we automatically transfer it out to the correct jurisdiction. However, if somehow it sneaks on and then eventually through contact tracing or we get better records from the medical facility, we're able to identify it's an outside jurisdiction case, well, we'll transfer it out. However, it was already snuck onto our list because of the way the clinic reported it to us. So that means that it has to be deducted from our total case count. So that's just one other way. And there's many different ways that cases can be incorrectly added to our list. It's not one person's fault. It's a variety of issues going from incorrect jurisdictions to just a typo. I'm sure all of y'all have had typos before. And then we just have to catch those and then correctly remove it so we're able to report to the public the correct amount of cases that Hays County actually has.
Yeah, and we're pulling information from a variety of sources, different providers, several hospitals, labs, clinics, doctors' offices. I think there's at least 3 hospitals that I know of in Hays County. And then we're coordinating with other health departments in other counties as well. So I just hope that people understand it's exactly what you said, Hayden. There's room for improvement, but there's probably always going to be a little bit of noise. And that's why we're doing these weekly audits to make sure that our data is as accurate as possible.
100% correct.
Eric, did you want to add anything to that part of the discussion?
Nothing really there. Hayden covered that very well. I saw that there's a couple questions that were sent to me, so I wanted to address those.
Okay.
Someone had asked the question of at what point, at what point would we advise shutting down things again? As a health department, we provide recommendations to the elected officials, but ultimately it's the elected officials' decision. It has a lot to do with, our cases per day, our positivity rate, which right now we're sitting at about 7.2 as our positivity rate for the last week. I think this week it might go up a little bit more. Just in comparison, the 2 weeks ago, I believe it was at about 6.9. So it is slightly climbing. We're seeing more positive cases, but we are seeing a lot of testing. But again, when it comes to shutting things down, that's not the health department's decision. That's not our call. We just provide the information and consultation to elected officials for them to make the decisions of how they want to proceed.
And I think we should point out that local orders can never supersede state orders. So some of it may depend on if Governor Abbott decides to make changes or restrictions or close businesses down or lower the capacity levels. But anything that we do locally would never be more than what they do, tell us to do from the state level.
I've got another question that was here, wanted us to discuss upcoming holidays concerns. You know, I know it's hard. Everybody is having a little bit of COVID fatigue right now. They've been dealing with this since March, you know, haven't seen loved ones, haven't seen family, and everybody wants to get together for the holidays. And I understand that completely. It's not something that we are recommending in any sort of way. But if you do have to get together with your family, if it's something that you've already scheduled and you're not going to cancel, we just want you to do it safe and do it the proper way. Outdoor picnic style would be ideal. Having large gatherings of people from all over indoors is just increasing your risk of somebody who might just be asymptomatic and could be spreading it throughout the whole family. And definitely COVID is not one of the gifts that you want to give this year during the holidays. But making sure that you're wearing masks, being outdoors, washing your hands. I know it's family. Everybody wants to see each other and embrace each other. You haven't seen them in a long time. But you know, a fist bump is just as loving. You haven't touched their hand in a long time, rather than a hug, rather than that kiss that you haven't seen them. We just want everyone to be safe. We're here to try to protect everyone. We're definitely discouraging large indoor gatherings for Thanksgiving, but like I said, if you have to do it outdoors. Have fun. It should be beautiful weather still. Outside, less chance of spreading.
Thanks, Eric.
That's all the questions that I have that were previously sent to us.
Were there any other questions that were pre-submitted? I think you covered them.
I think that's all. So I guess I'll hand it back to you then to open it up.
Thank you very much. Okay, so looking over at the group here, we have quite a few media on the call, which by the way is being recorded for anybody who wasn't able to make the live call. So I think I'll just go down the list, and if you hear me call your name or your organization, you can unmute yourself and ask your question. All right, so Philip Pavelka. You have any questions? Philip? All right, moving on. We've got someone from KView on here, but it doesn't say their name. You know, I don't think, let's just do the little hand raising thing because I don't see anybody who has a question.
I do. This is Tahara with KXAN. You don't mind if I jump in?
No, not at all.
Okay, awesome. So I'm wondering, we covered a little bit yesterday about hospital capacity in the general area, but I was wondering specifically for Hays County, if you could tell me what the hospital capacity is like, what percentage we're currently seeing of COVID patients overall, and if there are any individual hospitals that are currently being maybe not overrun, but are at capacity. We got a tip that maybe Ascension in Hays was, but I'm not sure if you know.
No, at the moment, our hospitals, there's plenty of beds, there's plenty of ICU space. Excuse me, sorry. There's plenty of ICU space. We have not heard of anybody being overrun. A lot of the COVID patients that are having extreme issues need ICU, need intensive care. They are being transferred to hospitals, usually in Austin or into San Antonio, away from our 3 hospitals that we have here. So at the moment, the 3 hospitals that we have are not at full capacity in any sort of way and still have plenty of space.
And as I understand it, then I think we had yesterday's report said we had 10 Hays County residents hospitalized. Is that right?
Correct, yes. Out of those 10, 6 of them are here in Hays County and 4 of them have been transferred to a different hospital.
Okay.
Hi, this is Karima Hernandez from Univision. My question is, we know that 45% of the Hispanics in your county, or 45% of the affected in your county are Hispanics. What are you guys doing to help this community affected by COVID?
So, we have created a partnership with Curative, free testing for any Hays County citizen. It's actually free testing for any citizen at all. So in all 5 of our major cities, we now have a place set up to where it is free testing for anyone. So that is what we're trying to do, is identify the people who are not showing symptoms but are testing positive. And it's definitely working. We have seen our testing numbers start to skyrocket, especially in the Kyle, Buda, San Marcos area. Where Curative is testing somewhere around about 500 people a day almost now. And so identifying those individuals that are asymptomatic, and then also it allows people to not just have themselves tested, but they can take the whole family there. And they're doing the cheek swab rather than the nasal swab. And so we're seeing a lot more children actually get tested as well, because it's less invasive and parents aren't as intimidated to have their child's cheek swabbed rather than, tickle their brain with a Q-tip. We're opening up the testing, identifying people, and just being able to allow free testing for anyone is one of the major things that we're being able to allow to that population.
There's also a free mask giveaway later tonight from 5 to 8 p.m. It's at the Centro Cultural, and I believe that's 211 Lee Street in San Marcos. The Hays County Emergency Management Team was able to secure about 5,000 N95 masks for that distribution. And so, Hays County, and I think the city of Buda also gave some funding to local school districts, which, a lot of our school districts here have more than 60% Hispanic kids. So I think there are efforts underway to assist in any way possible. There's also a couple of different programs around for small businesses, and including the one through Hays County is the ECAP program that's run through the Greater San Marcos Partnership, and they give grant funding to small businesses to assist with COVID-related expenses. And then I think Buda has one, and I want to say it's called don't ask, I can't remember what it's called. I shouldn't speak for Buda anyway, but I know they had a program as well. So there are definitely some things going on in Hays County to help everybody, but I think specifically for the Hispanic population.
Hi,
All right.
Sahar from the Hays Free Press.
Sahar, go ahead.
Yes, I have a question about the residents who are not students or who are not first responders. Are there any accommodations for them if they are in quarantine? Like any food supplies or anything like that going out to them if they cannot go out of their home and they don't have anyone to help them out?
So Hays County does not really have the resources to be able to provide this kind of, basically provide these resources to people. We had agreements with hotels and things like that at the beginning of this COVID outbreak. I don't know if those are still actually in existence to be able to help people isolate and quarantine themselves away. But unfortunately, as far as it comes to providing help with food and things like that, we don't have those kind of resources. A lot of the larger churches in our area have been able to help and step in and provide with that kind of resources for individuals. Unfortunately, that's not an answer really that I have. Kim, I don't know if you know if there are other programs out there that I'm not aware of.
I don't. I think the Hays County Food Bank has done quite a bit to help people. I know there have been some mass distributions through that organization, the city of Kyle and some local churches, and they've given away, thousands of pounds of food over the past several months. I think they have 3 or so more coming up for the rest of this year, maybe 2, I can't remember. Also, I just want to note to everybody that we have about 10 minutes left on the call. So I see Warren Brown, you have your hand up. Warren is with Community Impact, so go ahead.
Thank you. I'm just wondering if, based on the surge that we saw earlier this year, do y'all have any projections or expectations for this surge? How it will progress, how long it may last, if there's any sort of correlation available?
So earlier this year, about what the number of cases that we're seeing right now per day is about where we were right at the beginning of May. And then we had the Memorial Day, Father's Day, 4th of July surge that sent us skyrocketing, and the rest of Texas skyrocketing as well. That is our concern that we have right now, is the fact that Halloween, Thanksgiving, and Christmas and the New Year's right coming up, large gatherings, people wanting to get together. We're hoping that we don't see the exact same kind of increase, but unfortunately at the moment we are kind of trending in that exact same pattern. So saw a little spike after the first holiday. We're trying to encourage people to do Thanksgiving the proper way, celebrate with your direct family in your household, virtual visits with your family that's away, outdoors if you have to get together. So hopefully we don't have a repeat of what happened in June and July.
And I will just add here, Eric, that, and this might be Kim's personal belief, but I think it's a reasonable one, that so much of what is happening right now, we all have control over how we interact when we wear masks, how much we distance ourselves, if, not going out in big groups. So a lot of the control for this, I think, is on us, like each of us in the community, and remembering that we do these things to help everybody else and the most vulnerable in our community. So if there were anything that I could implore among our Hays County residents, is to keep doing what you're doing and be vigilant and don't relax. It's all in our hands, like literally it's in our hands. And while we can encourage and we can, have mandates and we can do all these things, I think we just all need to take it upon ourselves to make sure that we do our part to slow the spread of this virus.
Exactly. Yes, we're going out in public now. If you go to a grocery store and think about it, you're starting to see people who are getting a little more relaxed with the masks. They're wearing it under their chin. They're carrying it in their hand. We need everyone to understand that we are still in the middle of a pandemic. This is all of us working together to try to make sure that we don't have to go into a quarantine and a lockdown again. We are not here to try to shut down businesses, shut down schools, anything like that. But, if we continue to see the rate that we're going at right now, and we see the same thing that happened in June and July, that's going to be something that the elected officials are going to have to address if we start to see a spike again. So it is up to all of us to try to make sure that we're protecting each other.
And Eric, I know there was some new guidance that came out about children and mask wearing. I don't feel comfortable enough to address it, obviously, but I was wondering if maybe you could give us some insight on that.
So the old guidance basically said, it had mask mandates for anybody that was 10 years of age or older. It's now basically saying, it's highly recommended that everyone wear a mask. Please put a mask on your child. I don't exactly know why they did not include children in the first mask mandate, but what we are seeing are child care centers, younger children, pre-K through second graders. Those are where we're starting to see a lot of our cases show up in our ISDs and then in our daycare and child care centers. And so it is highly recommended that, anyone, if you're going out in public, have a mask on. It does help prevent the spread of the disease.
Okay, we can open the floor up to a few more questions before we get cut off. Anybody? I see folks from KUT. I see folks from the San Marcos Daily Record. Anyone else have any questions?
I can try to throw another one on if no one else is interested. What kind of, are there any other community outreach initiatives that y'all have planned just to kind of jump on top of the surge?
I can help address that, Eric and Hayden. I know that we are putting out some holiday messaging, and we're going to hopefully get some video out. And I know that we're also working with the other PIOs in Hays County, cities and schools, to try and push these messages out about, like the holidays are great, but we don't want to, do things in an unsafe manner and end up having a worse increase, higher increase after the holidays. So if we want to enjoy these holidays and spend time with our families, we've really got to step it up and take more precautions and, figure out how to safely have holiday gatherings. I think Eric said it a couple of times, smaller groups, outside if possible, only with your immediate family, staying distance, especially if you have, kids in schools or kids in college. I mean, those are some of the groups that I think we want to, make sure that they are following all the precautions, because sometimes they may not get sick or have a lot of problems, but they could pass it on to somebody in their family, maybe somebody who's older or has underlying health conditions. So that would be my recommendation.
I think there's also a follow-up question in the chat from someone else.
Yeah, thank you. That was mine, Warren. I can just say it real quick. I was just wondering, just a follow up, Eric. I know you told us a little bit earlier that you are transferring some patients from Hays County to other areas like Austin, Travis County. Can you just explain that process and the reasoning behind that? Like, has that been standard protocol since the beginning of the pandemic?
It has. And those are the hospitals. They're transferring within their own groups. So Seton Ascension hospitals will transfer someone to another Ascension that has a larger COVID wing or able to provide that critical care. That has been their standard from the beginning. It's multitude of reasons, whether it's just to make sure that there's enough bed space here in Hays County because Travis County is able, those hospitals are larger and able to provide better intensive care. Different reasons why, but a lot of the people who do test positive that need that critical care are getting transferred to more of the triage hospitals that are in Travis County.
Thank you.
If I understand correctly, Eric, you can help me out here. I mean, we don't make those decisions. Those are all from the hospitals themselves.
Correct.
Right?
Yes. We're not transferring anybody. We're not recommending the transfer of anyone. That is completely hospitals doing how their policy, how they want to handle things.
All right.
I have a quick question if we've got time. I just want to understand there's some misconception around how kids can spread the virus. Can we clarify the likelihood of a child spreading the virus from child to adult?
It can spread from child to adult just as easily as it can from adult to adult or child to child. There's no difference in the way it spreads. The risk that comes with this is the fact that a lot of minors are asymptomatic and tend to be carriers and don't know that they have the disease. And so they go and hug their parents. And that's another thing too. It's hard to isolate yourself from a 2-year-old, 3-year-old. They're needing constant care or attention when they're at school, daycare. And it's really hard to teach social distancing to a 3-year-old. So it can easily spread from child to adult just as it can to adult. And so that's one of the things that we're trying to identify with our curative testing sites is, since we're not doing the invasive nasal swab, but instead a cheek swab, hoping and encouraging that people will have their children tested when they go there as well, to identify the ones that are possibly asymptomatic carriers.
Hey, we are running out of time, but I wanted to give a plug, and it's kind of a good segue. We have 5 locations in Hays County where you can get tested for free. It's with the company.
Looks like the Zoom call expired there from Hays County. However, a lot of good information to share, so we'll recount some of that if you're just joining us. Before the call was disconnected there, I do want to point out that the spokeswoman for Hays County was mentioning that there are 5 testing sites in Hays County where you can go and get a free COVID-19 test from an organization called Curative. And that's a partnership that the county has with that particular company. So I think that was the point she was trying to make. Information about that will obviously be on the Hays County website. So you check that out if you're wondering where to go get a free COVID-19 test in Hays County. Also, we should mention that it is available for anyone, even if you live in Travis or Williamson, Blanco, somewhere like that. you can still go to Hays County and get one of those tests from one of these curative locations in that county, 5 different cities there, so we'll just stress that. Additionally, the epidemiologist for Hays County is saying that they are seeing an uptick in cases. 73 new COVID-19 cases reported in Hays County yesterday alone. And he said the bigger concern was that there are 7 new hospitalizations that happened yesterday. That is the most in a single day, and that's what's most concerning. He did stress that the hospitals are in good shape. They are not running out of bed space at the moment, but that kind of concerning trend does raise alarms for them to kind of look out and also ask for everybody out there to do what they've been doing to protect themselves. That means wearing masks, that means distancing, that means washing hands, that means only being around people closely that you live with, that live in your house with you, and then otherwise being distant from them. And that leads us also to the Thanksgiving piece. We've been talking a lot this week, preparing people and trying to talk to experts about what we should expect to celebrate the holidays safely. And these officials today were saying that, admittedly, we all have a bit of fatigue through the pandemic. However, this is not over. It is still making people sick. It is still sending people to hospitals, and it is still killing them even. So for Thanksgiving, they are recommending that people do not get together indoors. However, that is a big ask for people. If you do gather together, these experts in Hays County and others across our area and the country really are saying to do it potentially outside. Get together outside, but still wear a mask around each other and distance as much as possible if you don't live with the people that are coming to eat at your house. These are things that we all can do. This is all a choice, and it will help ensure that loved ones are able to celebrate another holiday with you, because you all are all preventing each other from getting sick with this very highly contagious disease. So these health experts are really wanting people to emphasize that and to note that and to try not to do large indoor gatherings for the upcoming holiday next week. Again, we did mention that hospital capacity is in good shape in Hays County. There are 5 free testing sites in the 5 major cities in Hays County to get a COVID-19 test. And also this evening, there is a mask giveaway. That's from a free mask giveaway, we should say, and underline. It's from 5 to 8 p.m. at Centro Cultural in San Marcos. That is at 211 Lee Street. They have several thousand N95 masks to give away for free this evening from 5 to 8 in San Marcos at Centro Cultural. Additionally, I'm looking at my notes to see what else we should highlight. Again, they're just really stressing not to relax right now. We are tired of this. It's been going on for almost a year now, and we have the power to control where this virus goes and how this disease spreads. So everyone, please be safe. Please stay healthy. Do your part to protect not only yourself but your loved ones. We all know what to do. It has been repeated and over and over again these past few months. Wear that mask, social distance, wash your hands, get tested if possible. We can do all these things and control the spread of this virus, because that Hays County epidemiologist, Eric Schneider, warned that with this combination of holidays from Halloween to Thanksgiving, Christmas, and New Year's, these are all times where people want to get together, and that could lead to an even worse situation than what we had back in the summer. So again, this is all in our control to be able to stop it, to be able to ease the strain on our hospitals and our nurses and doctors who are still working hard every single day to keep us safe. So again, this is on us. We have more information over on our website. That's kxan.com and on the KXAN News app. So please download that to find out the latest information and resources about the COVID-19 pandemic. We'll send you there. Thanks again for watching, everybody. I'm Will Dupree here in the KXAN Live studio. We will see you back here throughout the day with additional updates. Please, everyone, stay safe, stay healthy, and take care.